An epidural injection is when we put medication into the epidural space, which is where the spinal nerves are, the spinal cord, or the discs. The epidural is a space. So when you're in labor and about to have a baby, they put a catheter in that space and continuously release anesthetic and pain medications to numb you from the waist down. In terms of an epidural injection we use for pain, we introduce the needle into the epidural space, inject the medication, and then as soon as that's completed, bring the needle back out. A lot of people also confuse epidurals with the injectate. So we can inject steroids, we can inject PRP, we can inject stem cells all into the epidural space. So just because on our plan in the targets we have epidural injection on there does not mean you're getting steroids. We used X-ray guidance to get the needle right into either the foramen or in the interlaminar space, which requires manipulation of the needle, driving the needle. And then once we're there, we put a little contrast dye to confirm that the pattern looks good and we're not in a vessel, and then we would inject the medication. If you have someone who's very detail-oriented and really takes their time to get the needle in the right spot for the epidural, you'll get a better result. Epidurals are used to treat very specific diagnoses. They can help calm down and treat the posterior part of the disc, as well as the nerves in the canal, or the elevator shaft as I like to call it, and the nerves exiting through the elevator doors or the foramen. So they will help with discogenic pain and pain coming from a nerve being impinged, such as pain in the leg. If your problem is facet joint arthritis, potentially, or sacroiliac joint arthritis or inflammation, this injection would not help. So mainly what we're trying to do is to calm down the nerves in the back of the disc, which should help relieve lower limb symptoms and that deep pain in your belly that sometimes discogenic pain is associated with.